I'm Tom Pietras. I'm a dermatologist with Forefront Dermatology in Cedar Rapids, Iowa. I want to thank you for visiting my website, and today I'd like to explain a little bit about who I am and my general approach to dermatology. My practice at Forefront Dermatology is focused on general dermatology. Now, what does that mean? General dermatology is taking care of the skin diseases that range from skin cancer to inflammatory diseases like psoriasis and eczema, as well as infectious diseases and a number of things in between. One of my main focuses is the detection and treatment of skin cancer. This is something that all dermatologists do, but something that I'm particularly interested in and see a lot of in my practice. The diagnosis of skin cancer typically involves a skin exam followed by a skin biopsy. This is a small procedure where we sample a piece of a concerning lesion and send it for pathologic analysis so we can make a diagnosis. Once that's done, then the treatment will be based on what the diagnosis is, but primarily is surgical, and additional procedures are required. Like I would say to many of my patients who have the diagnosis of skin cancer is that most skin cancers, when treated effectively, have no long-term effect on their overall health. The thing that originally drew me to dermatology when I was a medical student was the rigor and focus of the training. I was really attracted to being a specialist in one organ, that being your largest organ, which is the skin. In dermatology training, you learn everything from the biology and physiology of the skin, the histology and pathology, and then what's going wrong with diseases and how to treat them. It was that type of expertise that I was looking for, and that's why I feel that dermatologists are the best physicians to diagnose and to treat all skin disorders. Although my practice is in eastern Iowa, I'm not originally from the Midwest. I grew up in Tacoma, Washington, but have been in Iowa my adult life. I went to college in Cedar Rapids at Coe College, and then attended medical school at the University of Iowa, where I completed my internship and my residency in dermatology. I'm really happy to be here in the Midwest, and when I'm not in my clinic and diagnosing and treating skin disease, I spend the bulk of my time raising my two young children and spending time with my wife. What I find most rewarding about the practice of dermatology is the profound differences I can make in someone's quality of life. Something that people don't often realize is that skin diseases, even the minor and severe forms, can have a dramatic effect on one's quality of life. I feel like addressing that is extremely important with all my patients, and I try to help them understand their skin disease, as well as understand the expectations for our treatment and how their disease will progress and how it should respond. I like the practice of dermatology because it allows me to take care of people throughout their lifetime, from when they're new to when they're old, and that's one special thing about dermatology that I really enjoy. I'm Tom Pietras. I'm a dermatologist at Forefront Dermatology in Cedar Rapids, Iowa, and I would be honored to be your dermatologist.